it's very unlikely that you're going to have the strength or the confidence to advocate for yourself in the event that you would prefer to recover from drug addiction by going off of all drugs. I know many people, for example, who said, I've been on Suboxone before. I've had that hellish experience and I don't want to go back. I need to go to treatment. I'm addicted again, but I don't want to be put on Suboxone. Insurance companies pay to a great extent for people to go to these very expensive treatment centers. If you are a person in treatment, trying to get off drugs and recover from addiction, and you have told the treatment center that you don't want to use any medication, you just want to go through the program of recovery as outlined in the 12 steps or psychology and the peer support and all the other things, but you don't want to take medication. If the insurance companies learn of this through the doctors that they employ to oversee your case, they will make a recommendation or they will force the treatment center to release you as a patient. Since they refuse to take medication, they can be treated at a lower level of care. My name is Tommy Rosen, and welcome to In the Circle, this opportunity for us to explore the complex and often misunderstood puzzle pieces of the human condition. We look at things through the lens of truth. We understand that addiction is part of the human condition, and we explore questions each week that people have on their minds and in their hearts. Today is no different. Today we're going to be addressing a question which has come up so much in my entire 3 decades of recovery that it's not a question that's come from one individual. It's a question that's come from the collective. It's so important a topic to cover that I decided that I would dig in today and address this particular inquiry. The question is addiction a disease? The first aspect of exploring this inquiry has to do with the motivation or exploring the motivations why people ask it in the first place. In our society, we want to have the answer to that question, is this or that a disease? This means we'd like to know that there's something predictable, that the malady or the challenge has characteristics that we can look to and say, these are predictable characteristics of this particular malady. We want to try to understand the thing so that we can adopt a pathway forward to heal from it or to cure it or to move beyond it or whatever your language might be. We ask the question so that we can come to an understanding of how we can deal with the challenge. If the answer that I or anyone gives is yes, addiction is a disease, then the human mind gets to work and starts trying to find a solution to what we now understand as a disease. And what is a disease? Other than this predictable situation that having something brings about in your life, a predictable set of symptoms, if you will. So we could say addiction is a disease. And if we say that, how can we describe the disease? How does the disease affect a human being? What does it feel like to have this disease? And most importantly, what can we do to heal ourselves from it? If the answer is no, addiction is not a disease, this brings up a lot of confusion for us. If addiction is not a disease, what is it? If it's not a disease, it doesn't fit into a model where we can necessarily understand what it is and how to heal from it. But the minute we call something a disease, that gives us sort of a general format, a template from which to operate. Okay, we've got a disease. This is how it behaves. And now we're going to go out and we're going to seek a solution to that disease, and we're going to seek healing, if you will. So let's first deal with the idea that addiction is a disease and what that means in our society today. So in our society today, and I'm speaking generally now, when we can characterize something as a disease, typically speaking, the solution to that disease is going to be medical in some way, shape, or form. Typically, speaking generally. I have cancer, I need to treat it. I have kidney disease, I have arterial sclerosis, I have diabetes, I have liver disease, I have whatever the disease is. I have chronic fibromyalgia, I have pain in my lower back. Typically speaking, we've come to a point now in our society where when something can be characterized as a disease, we're going to look to the medical profession to try to solve that problem. Now, of course, there are a group of people in the world that prefer alternative methods of healing to try to address their diseases. But generally speaking, as a society, we look to the support of physicians and doctors to solve these problems for us. So if addiction is a disease, as it's been characterized in our society, recently in 2017, the Surgeon General of the United States of America, Vivek Murthy, did the first ever full report on addiction from his office, the Office of the Surgeon General. It's the first time in the history of that office that anyone had ever turned their light and gaze towards addiction as a problem and wanting to figure out what it was and characterize it and figure out the best practices. Number one, to describe it, and then figure out the best practices to overcome it or heal it or cure it. So in that report, and for a long time before that, our society has typically thought of this as a disease. And in that report, the Surgeon General confirmed this, that addiction is a disease of the brain and nervous system. It's characterized by always the potential for relapse back into the disease, and it's potentially deadly, and it's an incredibly difficult thing to get over. And the best that we can really hope for is what's called remission. So you can be in remission from the disease. This came out, and that's an unbelievable simplification of a document that was 400 or maybe 500 pages long. But the general consensus was that, yes, addiction is a disease. We in the medical profession see it that way now. And the good news there is that we can begin to treat it as such. Now, wherever you fall in your belief system about what the right and maybe not right or most effective ways to approach treatment of disease are versus other approaches, wherever you fall in the spectrum of medical treatments for anything, the way our medical system works is the American Medical Association, doctors, nurses, and medical professionals who are in that system generally treat the symptoms of disease. They do that primarily through surgical intervention and pharmacological intervention. So that means that surgery and drugs are the primary tools of the medical profession in our country in our Western world today. And this is, I want to make sure that everybody understands how grateful I am for doctors and nurses to be here. They are incredible under certain circumstances to help us through our pains, our symptoms, our traumas when we have physical traumas, whether that be a car accident or an accident we had in a sport or a ski accident, or certainly in war situations of conflict. We are so unbelievably blessed to have a system in place that can help us to deal with traumas such as that, and to have a system in place that deals with disease when it takes place, whether that be bacterial or viral in nature, or whatever the other cause of disease might be, toxicity or stress, epigenetic choices, or genetic problems that arise as part of the human condition. So we're incredibly grateful for that. So what I'm about to say is not denying the need and the place and the relevance for medicine, for goodness sakes. What I will say, though, is that the system is not set up for prevention of disease. It's set up to deal with the symptoms of disease as they arrive. So if we say that addiction is a disease, and the disease is here and prominent, then we're going to want to begin to treat it. And if the medical profession is good at anything, as we've said, it's good at surgery, and it's good at the administering of pharmacological solutions to problems like these, physical, but also in terms of mental health. So we have the profession of psychiatry, also very important. And in this case, so once our medical profession says very clearly and delineates addiction as a disease, that means that now it's going to set out to try to find pharmacological solutions to this problem, primarily. Now, I'm not, for the time being, including psychologists in this. Psychologists operate in a different theater, let's say theater of healing. They operate in the psychological sphere, the mental sphere, to a great extent, the emotional sphere. But medical professionals primarily dealing with the physical and the pharmacological, these kinds of interventions. Okay. So that report came out in 2017 from the Surgeon General's office. It was clearly, it was confirmed that addiction is a disease from the perspective of the American Medical Association. And we need to, therefore, as a society, we need to respond to this disease, this very widespread disease, this public health crisis. And so we start to look for a variety of pharmacological solutions to that problem. How does that show up in our society? Well, it shows up because, a number of ways. When you think about our society's solution to addiction, most of us, first of all, think about addiction as addiction to a substance. For example, alcoholism or drug addiction. So the terms we're using nowadays are substance use disorder. So there's a disorder in the way that we use substances such as alcohol or drugs. So because these people who have substance use disorder end up with addictive challenges. And so we're working as a society to try to alleviate the suffering of these people. And I think that's an unbelievably noble and wonderful thing to be working on. It's the focus of my life. But I am not a medical doctor, and I'm not within that particular way of seeing things. What I'm noticing, though, is in the field of addiction recovery, there's a couple of ways that people get sober in the world. One way is to go to a facility, an inpatient facility, and to seek inpatient treatment for drug and or alcohol addiction and other forms of addiction, which we could cover in more detail. I specifically write and speak about the big six, which I'll just name off for you. So they're drugs, alcohol, food addictions. That includes bulimia or anorexia or emotional eating or binge eating. The people addictions such as sex addiction or codependency. money-based addictions such as gambling or compulsive shopping, and then technology addiction, which I would dare say that almost all of us are caught up in that now in some way, shape, or form. Those are the big six. We see the need for treatment in all of those behaviors when they get out of hand. We see a very powerful need for treatment. So people can seek inpatient treatment for these behavioral disorders, if you will, these substance use or behavioral disorders. If you go into an inpatient treatment, more and more these days, certainly much more since 2017, but it's been growing for a while, treatment centers have adopted to a great extent, and there are certainly exceptions, but I'm speaking generally so that you understand the field, the landscape of recovery in the United States today. You'll see a big emphasis on what's called MAT, which is medication-assisted treatment. So the philosophical foundation of that idea is that if we use pharmacological intervention when someone presents in treatment, that we can create better outcomes. So that's the philosophical foundation of medication-assisted treatment, that we can become more effective, and also we can help people to lessen their discomfort as they're going through treatment, and we can give them, I think the general idea is more of a fighting chance. You'll have more of a fighting chance to get recovery than not. So that's the philosophical underpinning there. And so what we see, for example, when people come into treatment, if they're dealing with opiate use disorder, so this is the class of drugs known as opiates or painkillers, such as I think probably one of the most well-known would be heroin or OxyContin, one of the really extremely powerful and troublesome opiates. They all are addictive, highly addictive in nature and troublesome. But again, it's not all black and white. We're very happy to have this class of drugs available to us when we're in extreme pain physically. Unfortunately, or interestingly, this class of drugs also solves our emotional pain. It also temporarily removes our emotional pain. And therein lies a really, really important piece of this puzzle. So if you present in treatment as somebody who struggles with opiate use disorder, let's not forget fentanyl, Percocet, Vicodin, Dilaudid, all of it. These are all, and opium these are all a class of drugs that come from the poppy plant and from opium and tweaking or tinkering with that plant and that substance. When you show up addicted to that at a treatment center, you and the treatment center have to face a pretty powerful dilemma. There's a problem. And the problem is that you're going to be struggling for a period of time as you withdraw from the addiction, the physical addiction to that thing. It will be suggested to you, or at least you will be asked if you would like to be put on some medication that can help you with your withdrawal symptoms, which everybody wants help with that, and whether you want to stay on that medication or you get on that medication for a period of time beyond the withdrawal. And this is where we get into some really tricky territory. The medications we're talking about are medications like Suboxone, for example. Suboxone is a combination of drugs that, when taken together, greatly reduce the agony associated with opiate withdrawal. And therefore, I am really for the very short-term use of Suboxone for severe opiate addicts who are going to go through a very agonizing withdrawal. Absolutely. I understand the sort of, I'm talking about somewhere between 4 days and 10 days of usage of a drug like Suboxone, which can assist a person through that very difficult initial period. Originally, when I first heard about Suboxone, or when it was becoming really popular in treatment, I think was somewhere in the 90s, maybe in the early 2000s, and it sort of grew and grew and grew from there. And what you need to understand about this drug and other drugs like it, buprenorphine, which is one of the drugs in Suboxone, which is sometimes taken by itself, or methadone, these drugs are themselves highly addictive. They're also from the opiate family. They behave a little bit differently than taking heroin or fentanyl or Oxycontin, but the point is that they're addictive. And not only are they addictive, they themselves have an unbelievably painful withdrawal associated with them. When you become addicted to those drugs, Suboxone, buprenorphine, methadone, it is equally, if not more, agonizing to withdraw from those drugs. That's one of the major issues here. But when you show up, you'll be asked if you want to take those drugs, or it may be suggested to you, or in certain treatment centers, that's just their policy. Like, if you come to our treatment center, we will put you on this class of drugs because we think that's the best way. So back in the day when Suboxone was coming around, and I first heard about it as this, miracle drug for helping people who are dealing with opiate addiction through their initial withdrawal, I was like, wow, that's the most amazing thing, because that agonizing withdrawal is a big part of the reason that opiate addicts don't try to get sober, because the withdrawal is so painful and so awful that many people fear it so much they just would prefer to stay in the misery of addiction than go through that 5 to 10 day period of hell that they know they're going to go through in giving up the opiates. So when this drug Suboxone came along and other drugs like it, I was like, wow, what an amazing thing that you could take a drug that will just relieve you of a large percentage of that agony and those terrible symptoms. Well, somewhere along the line, I'm not sure the year, but I think it was in like the 2010s, maybe 2010, somewhere forward, maybe even before that, it was figured out, hey, we can put people on these drugs long term. And if we keep them on the drugs long term, all these decisions need some kind of philosophy behind them. The philosophy behind this was, if we keep people on Suboxone, let's say for a year or 6 months or 10 months or whatever it is, if we keep them on Suboxone for longer, the idea is they'll have more of a chance to catch recovery. And it's less likely that they'll relapse if we keep them on these drugs long term. I cannot quote to you the scientific studies that have been done then to come up with that philosophy or since then. I can only tell you that what I'm seeing out in the field as a result of that decision to put people on Suboxone long term is overwhelmingly negative. It is not a black and white issue. I do know some stories of people who have been put on Suboxone long term, who managed to get off of Suboxone and who are sober today and having a great recovery. But those cases, in my experience, are few and far between, and they're much less frequent the case than people who suffer and remain in addiction either to that drug, the Suboxone or another similar drug, or they go back to other opiates and they stay stuck in abject addiction. What happens for a person to be put on Suboxone long term? They will become addicted to it. There's really no question about that. And when they're addicted to it, that means that they're going to need medical support in getting off of it at some point. So the luckiest people who were put on Suboxone long term, they have a wise and experienced psychiatrist who understands addiction medicine, who can help them to taper off Suboxone after whatever period of time. And they also need a program of recovery that's been taking place the whole time that they've been on the Suboxone. These are the people that have the best results being on Suboxone long term. Again, I have found those people to be few and far between. Much more frequently, what happens is people get addicted to that drug and it's nasty. There's another thing aside from the addictive quality of these drugs is that it doesn't allow you to feel the full range of your emotions. And it changes your brain chemistry, of course, as all opiates do. So until you're able to get off of those drugs, it's hard to return to the state of balance and the state of health and wellness that I liken to true recovery and true health. So that decision to go from using Suboxone for a very short period of time to help people get through the hard, painful aspects of detox and withdrawal, and that shift to putting people on Suboxone long-term because they felt it would lead to greater recovery efficacy, which I'm just not seeing that play out in the world. That decision has been an incredibly painful decision for many people. I've probably spoken to more than 100 of them personally who have direct experience with Suboxone or buprenorphine or methadone addiction. And it's really not pretty what they report. There's another element of this that's perplexing and concerning. The concern is that if you show up at treatment as a person who is addicted or has been addicted to opiates, and they make a suggestion to you, like, we recommend that you try a run of Suboxone or another one of these drugs that will help you through the difficulty, it's very unlikely that you're going to have the strength or the confidence to advocate for yourself in the event that you would prefer to recover from drug addiction by going off of all drugs. This means that the likelihood of you saying yes or giving in to the suggestion of the people that are there receiving you in your intake process into treatment, the likelihood of you saying yes to that is extremely high. You're in a very, very vulnerable position. And so there's nobody really advocating for you. So I know many people, for example, who said, I've been on Suboxone before. I've had that hellish experience and I don't want to go back. I need to go to treatment. I'm addicted again, but I don't want to be put on Suboxone. Well, it's rare today to be able to find a place where they're comfortable with somebody coming in and not taking these drugs. Furthermore, and this is the very complex and weird, sort of it gets a little ugly here, a little dark. Insurance companies pay to a great extent for people to go to these very expensive treatment centers. And these days, insurance companies have doctors. They hire doctors who look over the cases of many of the people that the insurance companies are insuring in treatment. And I've been told this by a number of treatment center owners and professionals who have said that in this day and age now, if you are a person in treatment trying to get off drugs and recover from addiction or some substance use disorder, and you have told the treatment center that you don't want to use any medication, you just want to go through the program of recovery as outlined in the 12 steps or psychology and the peer support and all the other things, but you don't want to take medication. If the insurance companies learn of this through the doctors that they employ to oversee your case, they will make a recommendation or they will force the treatment center to release you as a patient, because they will say, and this is the language, this patient, since they refuse to take medication, they can be treated at a lower level of care. So if you want to go through treatment the old-fashioned way and you actually want to get off of drugs and you're not into medication-assisted therapy treatment, you'll only likely be allowed to stay in many of the treatment centers, many of the most reputable treatment centers, for a short period of time, because the insurance companies will pull their funding of your treatment. If they find out that you're not taking medication, to them it means, oh, well, it must not be so serious, which is absurd, because anyone who shows up in treatment for addiction to alcoholism or opiates or cannabis or any of these things, it's always going to be serious, especially if it's this class of drugs, opiate addiction. So that's deeply concerning. One of the unfortunate side effects of this positioning is that treatment professionals, addiction counselors, psychologists, and psychiatrists are starting to move in the direction where the treatment of drug addiction or alcoholism, substance use disorders with other medications is becoming now the norm. It's being normalized. So in your education, as you're learning to try to help other people, your mind and your focus as a treatment professional is being turned towards, there's a bias towards medication. So the unbelievable side effect of that is that treatment professionals are not learning how to treat addiction in the non-pharmacological ways, or I should say they're not learning in many cases, right? Speaking generally, they're not learning the holistic approach to healing addiction. And the other part of this that's very, very concerning is that if you are one of those people that has been put on Suboxone or methadone or buprenorphine or this class of opiates to treat opiate addiction, when you leave the treatment center, if you've been on those drugs for let's say you stayed at treatment for 2 weeks or 3 weeks, or if you're lucky, 4 weeks, or if you're really lucky, longer, and Suboxone and this class of drugs was part of your treatment there, well, you're now addicted to that drug. And you're going to need to see a psychiatrist outside of the treatment environment now who's going to continue to prescribe this drug legally, very legally, because this is part of your recovery protocol. And you are now in an addicted state, and you're now having to advocate for yourself as a person who's seeking recovery. You're going to have to pick a date and a time when you're going to get off of these drugs. The only challenge is unless you're with someone really wise and someone really smart, this could last a while. And the taper off of these drugs is difficult and painful, as I said. So you're going to need a tremendous amount of support in getting off of those drugs. And guess what? Now you're not in the protected environment of an inpatient treatment center. Now you're out in the world, and hopefully you have a recovery program like you're going to 12-step meetings, you're working with a therapist, you're working also with the psychiatrist. Hopefully you're working with, if you're working with a medical doctor, you're working with someone who really understands healing and addiction and how to get off of these drugs, because now you're really in a very vulnerable place out in the world. Because when you got to treatment, you had to get off one class of drugs. Now you're out of treatment and you're going to have to get off another same class of drugs, but you're going to have to get off of those if you really want to experience health and healing and wholeness and recovery. How did this come about? I think part of what we're seeing is a reaction to the unbelievable overdose rate that we've seen take the lives of hundreds of thousands of Americans since the legalization of OxyContin in 1995 by the FDA. The FDA approved it in 1995, and it was marketed, and many of you know the horrible story of the marketing and the misrepresentation and the dishonesty and the fraud around the dissemination of that drug, OxyContin. Highly addictive, unbelievably addictive. And part of that was 20 years later, in 2015, we realized, wow, there's this unbelievable number of people who are dying of overdose from these drugs in the United States every year. That number has grown during the pandemic. I think the number was over 100,000 people died, over 100,000 Americans died from an opiate overdose in the year, I think between June 2020 and June 2021. Something around that figure. And so, when that many people start dying, politicians, it could become a political issue, and our society starts to call out, and families and loved ones and people who are suffering the grief of the loss of somebody dear to them start to cry out for help. And it enters the political arena. All of a sudden, political leaders are applying themselves in newfound ways to this new, what seems to them to be a newfound problem. And this is just another cycle of the horrors associated with our war on drugs and our misunderstanding of addiction in our society. But all of a sudden, the politicians start to pay very close attention to this because their jobs depend on it. And they need to come up with a solution to a problem that's directly affecting their constituents in the most painful and adverse ways. I think they turn to the experts to try and figure out this very question. What is this thing? Is this a disease? How can we treat it? How do we deal with, the disease of addiction to these drugs, this pandemic, which has now taken over our society, is one of the most prominent public health crises that we face. And I think the politicians do their best. Obviously, nobody wants other human beings to suffer and die unless they're very insane. And so, all I'm saying here is that the right information and the right understanding of addiction and how to recover from it is going to be critical if our leaders are going to make decisions that are going to move us in the right direction. And I want to come out on record and say that we haven't moved in the right direction. We moved in the wrong direction by focusing our effort here on a pharmacological solution to the problem of addiction. And it all emanated from the idea that we're losing a lot of people. This is unbelievably painful. We have to do something about it. Treatment doesn't seem to be working. The 12-step programs don't seem to be working. And that both of those statements need a lot of unpacking, and there's a lot of misunderstanding there. And so what we're going to do is we're going to now do what we do best as a system. We're going to employ our pharmacological, our pharmaceutical industry, the medical industry, the treatment industry, the insurance industry, We're going to bring, and the political machinery, it's all going to come together. We're going to save the day. And the way we've decided to do it, our strategy, is to lead with medication. You may not believe what I'm saying. You may think that I'm biased or that I'm providing information that is inaccurate or incorrect, just straight up. Some of you will think that some of this is conspiracy theory. I spoke to the chief medical officer of one of the largest and most prominent treatment centers in the world. Off the record, I said, why are you now using Suboxone as the one of the major tenets of your treatment program? And this man looked at me and said, are we on the record or off the record? And I said, we're off the record. And he said, government pressure. Straight up. And that really blew my mind. That really blew my mind. And that gave me great concern because I started to realize, okay, as a society now, and that means there are tremendous forces behind this movement, we're going to start to hear the marketing and the advertising and the communications about why this path that we've chosen, this medication-assisted path, is critical and effective and central and strategic, and this is going to work, and this is why it's working. And to my estimation, as an expert in the field of addiction and recovery, it is not working. It is creating more pain than solution. And as I said before, the thing I'm most worried about is this side effect of people not looking to the things that are going to be the solutions to this problem. And that brings me now to the second part of this answer. What if addiction isn't a disease? What if addiction isn't a disease in the way that we think about it? As the way we look at disease in our society as a thing that you can describe it, it has predictable characteristics, and then you can treat it with medication or surgery, or you can, there's a protocol for overcoming it, and you can apply that protocol, and in X number % of cases, that protocol is going to work. Well, what if we take a step back and we say, no? The answer to the question is no. Addiction is not a disease in the way we think about disease in our society today. What does that mean? And what does that open up as a possible pathway forward to healing? I like to look at the word disease and separate it into two words: dis and ease. The dis, let's say that's distance from. The dis-ease is a distance from ease. If we look at addiction as a distance from ease in our life, I find that presents some interesting conversations and some interesting possibilities. Now I'm asking myself a question. If I'm a treatment professional, or I'm a person who's struggling with substance use disorder of some kind or a behavioral addiction of some kind, I'm asking myself, do I have this thing? No longer do I have to claim I have a disease. It's a disease of the brain. It's characterized by relapse. The best I can hope for is remission. That's an unbelievably limiting story here. And I think it's disempowering to the individual and is disempowering to the health professional equally. If on the other hand, I have a dis-ease, do I have this thing? Yes. I can relate to the concept of being at a distance from ease in my life. I can relate to the idea that I've got chronic pain. I can relate to the idea that I've got chronic emotional pain. I can relate to the idea that if I'm addicted to a particular substance, I notice that when I don't have that substance, I feel particularly uncomfortable in my skin. If my memory serves me, as a person who's taken to using drugs and alcohol to solve that discomfort, I want to remind myself the discomfort in my own skin was there before I started taking the drugs and alcohol. Now the drugs and alcohol mask that discomfort, and they mask the causes and the conditions for the discomfort in the first place. That leads to a very interesting discussion where we're no longer now in the realm of just treating symptoms. We're now asking a more important and a question of more depth and value. If I've developed a dependency upon these drugs and alcohol, substances, or behaviors, why did I turn to them in the first place? What were the causes and conditions for these behaviors to become addictive behaviors in the first place? Furthermore, as an inquiry into how I'll recover from substance use disorder or any addictive disorder, I can now start to see that because when I remove substances from my life, even for a short period of time, I find that great discomfort come back and I'm uncomfortable in my own skin. I'm in the dis-ease of it. Now I can come to the right conclusion that the only way I'm going to be able to address the causes and conditions of the disorder, of the dis-ease, is to start with a position of abstinence. We'll first have to let go of drugs and alcohol, of these substances, so that my body can return to its natural rhythm. I'll sleep, I'll eat, my endocrine system, the hormonal system of the body can return to balance. I will begin to restore the balance of my nervous system. And the way that that happens is obviously not just through abstinence alone, but that's through treatment. That's what we used to do at treatment. As emotional dysregulation would arise, we would discuss it with our counselor. We would discuss it in our peer groups. We would turn to going outside for a hike or walking in nature. We would go to the gym or work out in some way and move the body a little bit. And we would begin to work out our physical, emotional, spiritual, energetic, mental challenge of dis-ease by working the 12 steps and all of these other things combined. This was sort of the idea. A holistic approach to treatment. The problem is with medications being involved in the mix for long-term involvement, it makes it very, very hard. It sort of puts off the return to balance of the endocrine system, the nervous system, the functioning of the brain, and the functioning of the body. Very, very hard to do for the reasons that we've spoken about. So I'm now in a discussion of, I'm now in that perspective of looking at addiction as a dis-ease, that there are causes and conditions that underlie the behaviors that come in. I now see my use of drugs and alcohol or any other addictive behavior, I see turning to those behaviors and those substances as my attempt to solve for the discomfort I'm feeling in my mind and body. That I was just trying to bring balance to my life, and that these drugs and substances and behaviors were my chosen method for healing. The idea was the right idea. I need to bring balance. But the method I chose was destructive ultimately. It may even have felt like the right method at first. Like when I first started smoking cannabis in my life, it relieved me of the discomfort and the challenge of my life, and it created some possibilities for enjoyment. Later on, I became dependent upon the substance to recreate any sense of enjoyment in my life or to relieve myself of pain. So I'd become dependent upon the substance to relieve my dis-ease. And there, I would reach a different kind of pain and a different kind of bottom, which is the bottom we all reach when we're going to an inpatient treatment center or when we realize we have to change our life. Now, this conversation about looking at addiction as not a disease and looking at it as a dis-ease leads us down a path towards what I call true recovery. Now you can begin to bring in certain practices, certain principles, certain routines into your life that are going to heal the mind and the body, reconnect you with your own heart and spirit, if you will. It's going to help you. This path will help you to start to narrow the gap, to close the distance between you and ease in your life. And you won't need medication for that. You won't need a human, you won't need anything. You're going to do that work with the assistance of guides and teachers, and you'll realize that recovery is possible. That you can, starting with abstinence, starting to work a program of recovery like the 12 steps, which I advocate for every day, starting at the right moments to bring in health and wellness into your program of recovery, really taking a deep look at your relationship with food, looking at all of your relationships with people, especially the relationship with this physical body, adopting the practice and principles of yoga and breathwork and meditation into your life. These are the things that get dropped by the wayside when we stay on drugs and use that as the focal point of our path forward. Of course, there are exceptions. As I said, it's not black and white. But generally speaking, the quicker that you can get off of drugs, get into a program of recovery which deals with mind, body, and spirit, the quicker you will start to feel better. You will close the distance between you and ease. You will become an easeful person. You will truly heal, and you will be able to thrive in recovery from addiction. And the most extraordinary things can happen from there. Your creativity comes online. Your joy goes way up. Your health and wellness go way up. Your spontaneity and sort of a childlike approach to life in the sense of being, truly spontaneous and free. That all comes back. Your intuition, your mind clears, your intellect comes online, your relationships improve. It all can happen for you. So is addiction a disease? Yes. No. It's going to be up to you. You're going to have to make a decision. Is this a disease of the brain that you can never get over? that is characterized by relapses, that the best you can hope for is remission? Or is addiction a state of dis-ease brought on by causes and conditions, reinforced by your own behavior? I like to say on that note, I believe we train ourselves into addiction. And I believe we can train ourselves out. It takes love, connection, guidance. It takes very powerful practices. I feel that yoga, meditation, and breathwork are a requirement for people. The same way that many people now feel medication is a requirement. I feel that if you have those practices and you have guides and mentors and a community of support, I believe that you can heal from addiction and thrive in your life. And that you can be free on a one day at a time basis. That does not mean that you can now use drugs and alcohol because you're no longer addicted. It means that you have grown up and woken up into a greater level of intelligence, into a greater state of awakeness, where you recognize that for you in this state of being, to use drugs and alcohol is no longer relevant in your life. It simply is, it would act at cross purposes to how you would desire to be and to show up in the world. That to smoke pot or to drink or to get drunk or to trip out in whatever way you're going to, that if that's the thing you're doing, from where you now operate from, that would be not an upgrade, but that would be to downgrade yourself. That would not be an improvement. And so that's what freedom is, true freedom is the recognition that not only do you not need those things, but to engage in those behaviors and those substances at this point would only be hurtful and detrimental and at cross purposes to who you actually are and to the unfoldment of your life and your journey as a human being. So that's a bit of a discourse about whether addiction is a disease as we see it in the society, or whether it's a dis-ease. Is there another way that we can look at it? What are the symptoms for people who have this disease as we see disease in our society? Well, I think the number one symptom that everybody notices is that regardless of what's going on in that person's life, regardless of the pain that they've encountered as a result of continuing along an addictive behavior, they don't seem to be able to stop. That's the number one symptom that we point to in our society as we characterize addiction as a disease. I can't stop this. Why can't somebody stop? For people who have never felt out of control in this kind of way, it's a very difficult thing to understand. When somebody says to you, I want to stop doing this drug, but I can't. You might say, oh, well, you must not really want to stop. That's really not true. I have seen people, and I've been a person who sincerely saw the damage I was causing in my own life and who wanted to stop using the drug or the substance or the behavior, but I wasn't able to do it at a certain point in time. At that point in time, in active addiction, active meaning I'm in the middle of using drugs and alcohol. For me, as a person with substance use disorder, I'm in the middle of using drugs and alcohol. You might say for that person, their brain is in fact in a diseased state. They're so used to, taking the drug, whether it's physically addictive or psychologically addictive in a way, doesn't make a difference in respect to what I'm saying here. If you're in an addicted state of any nature, you can't seem to stop doing the thing which is causing problems in your life. That's why I use the definition of addiction: any behavior you continue, despite the fact that it brings negative consequences into your life. Any behavior. So if you're in that statement, if you're in that state of addiction, you're in a really low sort of vibration, if you will. You're capable of behaviors that are not your best foot forward. These behaviors come out of what I call the frequency of addiction, meaning that energetic vibration that seems to accompany being in an active state of addiction. Behaviors like lying or cheating or stealing or violence, that addiction brings up these behaviors. And so we might think, oh, that person's a liar. That person's a cheat. That person's a thief. And in fact, they are lying, they are cheating, and they are stealing. In that state of consciousness of active addiction, that's who they are. For a little while, after that person gets abstinent from drugs and alcohol, they might still exhibit the behaviors that they were exhibiting as an addict or alcoholic, as a person with substance use disorder. That's because just becoming abstinent doesn't indicate a change in the habits mentally and socially and in every way that the person has developed for however long they've developed those habits. That's why there's an old joke in programs of recovery. What do you get when you sober up a horse thief? You get a sober horse thief. The only difference is the person has let go of alcohol or substance, but they haven't changed their character yet. That's the work of recovery that is forthcoming. So later on, when a person gets true recovery, they heal from addiction and they change their life. What now are the symptoms of the disease that they're supposed to still have? Well, they're no longer lying. They're no longer cheating. They're no longer stealing. What are the symptoms? If you were to say, oh, the symptoms of a person in recovery are that they still desire to use the substance that they're recovering from, that would be an inaccurate statement. When you have recovery, you no longer desire to use the substance to which you were once addicted. So then you'll say, well, where does relapse come from? What happens there? What happens there is a person has gotten off track from their process of recovery. They misunderstood and thought, I'm now a person who went to treatment, or I got a year sober. I must be okay now. I no longer have to pay attention to my life according to certain principles and routines. And that is the mistake that they made. Let me bring it home for you here. I've been clean and sober, abstinent, and I have recovery for 32 years. If I were to go out now and drink, would you say, oh, he drank again because he had the disease of addiction, and that's what we're told is going to happen? Would you say, oh, he relapsed because that's the disease of addiction, and this was going to happen sooner or later it wasn't his fault. He has a disease. Or maybe if I did go back to drinking or using drugs, I could say to myself, oh, well, this was bound to happen sooner or later. I know that I have the disease of addiction. I'm helpless in this way. All of that, of course, is nonsense. I've healed from the dis-ease. I've healed from the causes and conditions that led to that behavior. I've healed from the misunderstanding and misperception that drugs and alcohol were going to bring something to my life that was important. I healed from that. I healed from the idea that I needed to continue taking drugs and alcohol in order to have a fulfilling life. And in the place of taking drugs and alcohol, I built a fulfilling life. Now, I stay sober because I can't imagine ruining the life that I get to live without drugs and alcohol. Now I'm in love with life. I'm in awe of life. And I feel so blessed to have this opportunity to live consciously. I wouldn't want to go back. If I could get away with it and nobody found out, I would never go back. That's recovery. That's available to you on your hero's journey. That's available to everybody. But if you don't realize that a full recovery and joy and bliss and health and wellness and connection and love and a life beyond your wildest dreams are what's waiting for you in recovery, and if what you think is waiting for you is a life where relapse is always possible and you're always going to have a disease and the best you can hope for is remission, I don't know that I'd pursue that path. I want to pursue a path that leads to my freedom. And so I did, and you can, and countless of us do every day. And that's why it's so important for us to expand our understanding of what is addiction and how we can overcome it. And not to get stuck in this terminology of disease and the limitations that that places upon us. I can assure you, if I go back and use drugs and alcohol ever in my life, that was not because I had a disease. That was because I got off track from the truth of my life and the truth of me and the truth of what I am and who I am. That's why that will have happened. And that's just the human condition, is trying to stay conscious and stay connected to the truth of who and what we are every single day of our life. So, as you can tell, this is one of the most important topics because it informs our understanding of addiction, therefore, our understanding of the human condition. And it is absolutely going to inform our strategy in treating this dis-ease or this disease. So, is addiction a disease? Yes. No. You're going to have to decide. And when you make that decision, it is going to inform the ways that you move through it. I highly advocate for getting off of drugs wherever possible. And I mean all drugs, wherever possible. If you want to be on drugs, like antidepressants and those kinds of drugs, and you're working with a doctor and you trust that doctor and that's where you need to be, I encourage you to stay there. If you have the desire to get off of those drugs and all drugs, you will need to work with your physician and or psychiatrist to be able to do that effectively. If you're healing from addiction and you're wondering what role medication should have in it, I advocate for a very short-term use of drugs to help you move through the painful period of withdrawal. If you're withdrawing from alcohol or opiates, perhaps cocaine or methamphetamine, in some cases benzodiazepines, I recommend a short foray into some of these drugs which can help make those detox periods easier. But beyond a shadow of a doubt, return your body to its natural rhythm if you can. We don't live in a society that supports this idea. You have to see that. We do not live in a society that supports the idea of living without drugs. We live in a society that supports the idea of being on drugs. That is going to be the better way to go. I do not advocate for that. I do not believe that. My direct experience is not that. I do not take any drugs in my life. And it's the greatest journey ever. So, if you're getting into recovery, leave a little space for the idea that the real medicine comes from being honest and truthful with others, walking a path that is holistic in nature. I highly advocate for the 12 steps. That's going to help you to work out some of the relationships and the mysteries and understanding your life and yourself in a much better way. Going to help you to move the initial work to move beyond shame, to move beyond loneliness, and to come into community. And recognize one day at a time that recovery is the greatest gift. It's not something you leave your life to go do. It's the greatest gift. It can become one of the greatest things that's part of your life. And you get to live it. And it will lead you into freedom beyond what I think anyone can really imagine. So be very careful about the belief system you take on about what addiction is and what it isn't. We've trained ourselves into addiction, and we can train ourselves out. And the method that we work on in Recovery 2.0 is working with yoga, meditation, breath work, physical training and athletics, immersion in nature, diet overhaul, and a lot of connection, joy, and love between people. This, to me, is the recipe for an extraordinary life beyond addiction.